Welcome to the anatomy of the hamstrings. First, let's look at the semitendinosus. Its origin is the ischial tuberosity. Its insertion is on the pes anserine. The action is flexation of the knee and extension of the hip, and its innervation is the sciatic nerve. Now let's look at palpations of the semitendinosus. Let's follow a trail, starting at the greater trochanter, moving to the ischial tuberosity, distal, down the femur, moving medial to the pes anserine. Now let's do the resisted action for the semitendinosus. Having the client with their leg flexed, place your hand on their gastrocnemius or their calcaneus tendon and have them push into your hand with their leg. You'll feel the muscle contract and follow your trail. Now let's look at the semimembranosus. Its origin is the ischial tuberosity. Insertion is a medial tibial condyle. Action is flexation of the knee and extension of the hip, and its innervation is a sciatic nerve. Now let's palpate the semimembranosus. Again, starting at the greater trochanter, we'll move to the ischial tuberosity, moving distal again down to the medial condyle of tibia. The resisted action of the semimembranosus is very similar to that of the semitendinosus. We'll place the client's leg in a flexed action, have them push into you, and of course the muscle will contract, following the trail from the ischial tuberosity down to the medial condyle of tibia. Now let's look at the bicep femoris. The bicep femoris origin 2. The long head is in the ischial tuberosity, the short head in the lateral lip of linea aspera, and its insertion is the head of fibula. Action, of course, is the flexation of knee, extension of the knee, and its nerve innervation is the sciatic nerve. Let's palpate the bicep femoris. Again, we'll start at the greater trochanter, moving medial to the ischial tuberosity. We will also move distal along the femur to locate the linea aspera, the insertion point for the shorter head. We'll move distal along the femur until the head of fibula. The resisted action for the bicep femoris, very similar action to the previous two. Again, we'll start at the ischial tuberosity, move distal along the femur, head of fibula, have the client resist, and you'll see the muscle contract.